Hello students, today we study the next type of disease from the topic human health and diseases. So we study the disease AIDS. AIDS is the acquired immunodeficiency syndrome. It is fatal, that is death confirmably. That means it is fatal illness caused by erythrovirus. That virus is single-stranded RNA known as human immunodeficiency virus, simply HIV. AIDS can be called a modern pandemic affecting in all countries. It was first noticed in USA in 1981. But in India, first confirmed case of AIDS was in April 1986 in Tamil Nadu. Then we study the structure of HIV. So, see in the diagram how the virus is seen diagrammatically. Actually, it is spherical in shape. It is 100 to 140 nanometer in diameter. It shows the virus particle shows centrally located two single-stranded RNA molecules along with reverse transcriptase enzyme. That enzyme is important. It is covered by two layers of proteins. The outer layer is of matrix protein, that is, see in the diagram P17, while the inner layer is capsid protein, that is the P24. In this way, two coatings of proteins are present, and outside the matrix and protein layers, there is an additional layer of lipids impregnated with glycoproteins, that is GP120 and GP41. In this way, the structure of HIV virus is diagrammatically studied. This virus replicates in actively dividing T4 lymphocytes and can remain in a latent stage in the lymphoid cells. It has unique ability to destroy the T4 lymphocytes. Thus, HIV is found in large concentration in blood, seminal fluid and cerebrospinal fluid, that is the CSF, and also in small quantity in tears, milk, urine, saliva, cervical and vaginal secretions. Then next see the study or modes of transmission. There are number of modes, but main transmission modes are unsafe sexual contact. That means it includes oral, vaginal and anal sex. Then second one is the blood transfusion. It is transferred by the needles, sharing of needles. Third one is from mother to child, commonly known as transplacental. That means from pregnant woman it can transmit the fetus through blood circulation, and nursing mother can transmit it to her baby from breast milk. तर अशा पद्धतीनं मेन टाइप्स आहेत. Besides these, other methods of spreading of virus are rare and include accidental needle injury, artificial insemination with infected donated semen, and transplantation with infected organs. It is also found in urine, tears, saliva, breast milk and vaginal secretions, but not to be transmitted by these fluids unless it gets into injuries. Then, next point, see clinical manifestation. It is simply known as the symptoms. These symptoms are categorized into four stages. First one is the initial stage of infection with the virus and formation of antibodies, usually 2 to 8 weeks after initial infection. Next is asymptomatic carrier state, in which no signs of disease are seen. Incubation period ranges from 6 months to 10 years. Then AIDS related complex, these are known as ARC, with one or more clinical signs, that is recurrent fever for longer than 1 month, unexplained diarrhea, night sweat, shortness of breath, loss of more than 10% body weight, etc. And last one is the AIDS. It is the end stage of HIV infection. It has life threatening opportunistic infections like pneumonia, tuberculosis, and Kaposi sarcoma. Then, see the preventive measures. That means how the AIDS infection of HIV virus is prevented. AIDS has no cure. As we know, it has no cure, but prevention is the best choice for cure this disease. That means the infection or transmission is prevented. People educated about HIV transmission. Disposable needles and syringes disposed properly and immediately. Unsafe sexual habits must be changed. High risk groups should refrain from donating blood. Toothbrushes, razors, other articles which can contaminated with blood should not be shared. And routine screening must be done for blood donors, organ donors such as kidney, liver, cornea, lungs, then semen donor and growth hormone donors. Then patients undergoing hemodialysis and females in high risk group who are pregnant. Then diagnosis of the disease. Actually, two tests are available. First one is known as the primary test and another one is the confirmatory test. So, see, the primary test is ELISA test. Actually, it is known as enzyme linked immunosorbent assay. It is commonly known as the ELISA test. And Western blot test is confirmatory test. Then next is the treatment for the AIDS. Though there is no actually curable treatment, but certain medicines called as antiretroviral drugs can help in reducing the viral load and prolong the life of HIV patient. That means it increases the immunity of the AIDS patients. Such drugs are, for example, TDF, tenofovir, EFP, efavirenz and 3TC, that is the लॅमिविडी. अशा पद्धतीनं ट्रीटमेंट आणि डायग्नोसिस एड्सचं करता येतं. नेक्स्ट, adolescence. That means the maturity stage. In Marathi, it is known as the तारुण्यावस्था. Actually, this is the period between 10 to 19 years. So, what is adolescence? In simply see the different definitions. That is, first one is, it is the period beginning with the appearance of secondary sexual characters and the termination with cessation of somatic, that is body growth. Second one, or it is also known as It can be regarded as a transitional stage of physical and mental development of child occurring between puberty and the legal adulthood between 10 to 19 years of age, where individual is no longer a child but not yet an adult, or it is a phase of development of many fronts like sexual and reproductive maturity, mental development, adult identity, and transition from socio-economic and emotional dependence to relative independence. Then, stages of adolescence. Actually, the adolescent stage is divided into four stages. First one is the early period, that is continued from 10 to 14 years, and it includes beginning of appearance of secondary sex characters. बॉडीमध्ये चेंजेस व्हायला सुरुवात होतात. देन सेकंड वन इज द मिडल पिरियड दॅट इज 15 to 17 years and it is characterized by complete development of secondary sex characteristics. वयात येताना जे बदल होतात शरीरामध्ये. अँड लेट पिरियड दॅट इज 18 to 19 years, total development or establishment of physical maturity, abstract thinking, intellectual functional identity, stable relationship, and from childhood to adulthood relationships. टोटल ग्रोथ मानसिकदृष्ट्या, आरोग्यदृष्ट्या, शारीरिक सगळी ग्रोथ झालेली असते. दॅट इज द लेट पिरियड, दॅट मीन्स कम्प्लीट अडोलसंट स्टेज. देन फिजिकल चेंजेस ऑफ अडोलसन्स. Physically, there are changes occurs. First is the growth spurt. It occurs in both boys and girls, that is the total development of the secondary sexual characteristics, that changes occurs physically in the body. Then second, sexual development, that means the sex organs enlarge in both male and female. And oogenesis means किंवा ovulation, menstruation, initiation of sexual behavior starts. Then next, emotional and social changes. This includes own identity establishment, fantasy, daydreaming, attention seeking behavior, emotional instability, full of energy, sexual attraction, a rapid mood changes, conflicts with family, behavioral code. So number of changes occurs during this stage. Then mental health and adolescence. Actually, mental illness is associated with psychological or behavioral manifestation. These are classified as either psychosis or neurosis. Psychosis includes delusion, hallucination, disturbance in thinking process. The psychosis lead to Alzheimer's disease, schizophrenia, depressive psychosis, amnesia, bulimia, anxiety, anorexia nervosa, etc. And the neurosis includes schizophrenia, illusion, and hallucination. Adolescents view their friends, then peer group, more important and influential than their parents, and this may lead to different kinds of addictions like smoking and taking drugs. Then addiction. Actually, addiction is a complex condition. व्यसनाधीन कशी होतात लोक, आणि ते व्यसन म्हणजे काय, तर दिस इज ए कॉम्प्लेक्स कंडिशन कॅरेक्टराइज्ड बाय compulsive use of substance despite of its harmful consequences. Addiction may involve the use of the substances, that is the drugs such as alcohol, opioids, cocaine, nicotine, and others, or behaviors such as gambling due to these drugs. Addiction overall results in the impairment of physical, physiological, and psychological functions of the body. Then there are number of different causes of substances abuse during adolescence, and these are insufficient parental supervision and monitoring. This is the one of the most important cause due to which the adolescents having or adolescents abuse the drugs. Lack of the communication between children and parents. Then poorly defined rules. Then family conflicts. Favorable parental attitudes towards alcohol and drug users. Expectation from drugs use and a risk taking behavior. अशा पद्धतीनं number of causes आहेत. Like this, there are methods to control drug abuse, and these are prevention. As we know, the prevention is better than cure. Then next one is the avoid undue pressure. That means the child should not be forced to perform the capacities in studies, sports, and other activities. Don't give the pressure. Then education and counseling of child. It should be done to help them face problems and stress, to accept disappointments and failure as a part of life, and channelize the energy of child in sports, studies, and other constructive activities. म्हणजे मुलांना चांगल्या गोष्टींसाठी प्रवृत्त करणं हे फार महत्त्वाचं आहे ह्या adolescent स्टेजमध्ये. Then next point, that is the drugs abuse. That means effects and types of drugs. The drugs which are commonly abused are opioids, alkaloids, and cannabinoids of coca. We study one by one. First, opioids. Drugs binds to appear receptors present in central nervous system and gastrointestinal tract. So, heroin or smack is chemically diacetylmorphine. See in the diagram. The example, that is the opium poppy plant, that is commonly known as the Papaver somniferum. Heroin is a depressant and slows down activity of the body, and the opioids extracted from, or heroin extracted from, the latex of poppy plant. See in the diagram. The poppy plant with inflorescence, then dry fruits, and the young fruits with latex. Then next drug is cannabinoids. Cannabinoids interact with receptors present in brain. These drugs interact with receptors which are present in brain. Inhalation and ingestion of these substances affects the cardiovascular system. See the plants in the diagram. You might seen these plants. That is the cannabis sativa. From this or from the different parts of the plants or inflorescence leaves, the drugs are formed such as marijuana, hashish, charas, ganja. So all parts of the plants are useful for making the drugs. Then cocaine, next one. See the plant. coca plant, that is the Erythroxylum coca. This is an alkaloid obtained from coca plant, Erythroxylum coca. It increases level of neurotransmitter, and that neurotransmitter is dopamine. And if the excessive doses taken, it causes the extreme happiness, irritability, and paranoia. Then the next, that is the hallucinogens, that is the daydreaming or mind expanding drugs. It is also called, or it is an alkaloid causing daydreaming. दिवसा स्वप्न बघणं म्हणतात तो प्रकार आहे. Lysergic acid and cannabis are hallucinogenic substances, and these are obtained from the Atropa belladonna and Datura species. म्हणजे धोत्रा ह्या वनस्पतीच्या कॅटेगरीमध्ये येणाऱ्या स्पेसीज. these are known as the hallucinogenic properties. धोत्र्याच्या वेगवेगळ्या स्पेसीज आहेत, व्हरायटीज आहेत. त्याच्या फॅमिलीमधले जे प्लांट्स आहेत, डायग्रॅममध्ये बघा, एक वेगळं प्लांट आहे दॅट इज नोन ॲज द ॲट्रोपा बेलिडोना. आणि ह्या प्लांट्सपासून अशा पद्धतीचं हॅलोसिनोजेन्स फॉर्म केले जातात. दीज आर hallucination are unreal perception of unreal objects due to disorder of nervous system. Then these addictions and dependence, actually addiction is a physiological psychological attachment to certain effects. These feelings drives people to take them even not needed. गरज नसताना सुद्धा त्या ॲडिक्शनकडे माणसं खेचली जातात. रिपीटेड यूज ऑफ ड्रग अँड द टॉलरन्स लेवल ऑफ रिसेप्टार इन्क्रीजेस. परत परत ड्रग्ज घेतल्यामुळं टॉलरन्स लेवल इन्क्रीज होते रिसेप्टार्सची. These receptors respond only to higher doses of drugs or alcohol, leading to greater intake and becomes addict. Dependence is the tendency of the body to manifest a characteristic and unpleasant withdrawal syndrome if regular dose of drugs is discontinued. म्हणजे जर अवेलेबल झालंच नाही किंवा डिस्कंटिन्यू झालं तर त्याचाही इफेक्ट शरीरावरती होतो. अँड धिस इज कॅरेक्टराइज्ड बाय अँक्झायटी, चिडचिडपणा, ट्रेम्बलिंग, थरथरणं, नॉसिया, किळस येणं, sweating, which may be relieved when use is resumed. Then next, the effect of drugs or alcohol abuse. There are number of effects which are occurs, such as behavioral changes. There are adverse effects of drugs, and these violence occurs during this. Then coma or death. एक्सेसिव्ह डोसेस ड्रग्स किंवा अल्कोहोलचे घेतले तर रेस्पायरेटरी, कार्डिओव्हॅस्क्युलर, सेरेब्रल हिमोरेज ह्याच्यावरती, ह्या ऑर्गन्सवरती जनरली इफेक्ट होतो. देन सोशल चेंजेस. जिथं आपण राहतोय सोसायटीमध्ये किंवा रिलेशनशिप्स जे आहेत आपले ते बिघडण्याची शक्यता असते. देन क्राईम्स. देन ॲडवर्स हेल्थ इफेक्ट किंवा डिसीजेस लाईक HIV infection, hepatitis B. Then misuse in sports. स्पोर्ट्स म्हणजे आहेत ते या ड्रग्सचा मिसयूज करतात टू ऑप्टेन द स्ट्रेंथ. इट इज नॉट ॲक्च्युली द बेनिफिशियल. इट इज ओनली फॉर टाईम बिईंग beneficial in the sports or events, but lifelong it affects on the body. Then it also shows the drugs also effects, side effects of the use of anabolic steroids in females, and it also shows the effects in males. Then last one is the prevention and control. That habits during young age increases in adolescent stage. म्हणजे लवकर लहान वयात लागलेली सवय अडोलसंट स्टेजमध्ये वाढत जाते, कमी होत नाही. आणि हे कमी करण्यासाठी पॅरेंट्स अँड टीचर्स हॅव ए स्पेशल रिस्पॉन्सिबिलिटी फॉर द ॲडिक्ट पर्सन्स. So, the best way to prevention and control is, as started, I says that prevention is better than cure for all types of diseases. Thank you.